Hey, what's up everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and we're going to do some more A&P lecturing today. Specifically, we are going to cover a group of muscles known as the quads, or the quadriceps muscles. So, let's take a look. Alright, let's start out with a close-up shot of the quads here. Doesn't really do us much instructive purpose except to show their location right here in the anterior part of the thigh. And yes, these do contribute to some of this squatting action, but they're primarily known as leg extenders, and that is when he does this kick forward with his legs, that's called extension of the leg, sometimes referred to as extension of the knee, and that's primarily what the quadriceps are for. Right there where he hits that ball and he kicks that leg forward. Yes, there's some other muscles contributing to it, but to get that raw power, quadriceps are important for that kind of motion. Now we will talk about a bonus muscle, a fifth one that's associated with the quads, but not considered to be one of the quads, and it will help us do the action you see here of crossing our legs, also over here on the left-hand side. So let's check these out in more detail. Here's a nice little spinny picture showing the 4 quadriceps muscles as 4 different colors. Let's talk about the first 2 here on the list, rectus femoris, the blue one, and vastus intermedius, the green one. So rectus femoris, notice it's a little bit different than the other 3. It's going to originate a little further up the skeleton on the inferior iliac spine, not the superior one, but the inferior iliac spine. And it will reach all the way down to the patellar tendon, which is on the other side, or the inferior side of the patella, as I show in the picture on the left. It will, of course, extend the knee as the quads do, but because it does have an origination up there on the ilium, it will help you flex your hip as well. All 4 of these will be innervated by the femoral nerve. The next muscle we'll check out here, vastus intermedius, is right underneath rectus femoris, deep to it if you want to use the correct terminology. A lot of pictures, models, it's obscured by rectus femoris. Sometimes it's even left out because rectus femoris covers it completely. It's got different origin in the front and lateral aspects of the femur. It will insert not in the patellar tendon, but in the quadriceps tendon, which is the tendon above the kneecap that I've shown there on the left. Extension of the knee as quads do, and innervated same way femorally. Right, the last 2 are 2 more vastus muscles. So we have 1 rectus and 3 vastus. So vastus lateralis would be the yellow one, and vastus medialis would be the red one. So lateralis originates on the intertrochanteric line, that is that ridge of bone in between the 2 trochanters on the femur, and some of it does originate on the linea aspera, that long line that runs down the femur. Insertion at the patella and the tibial tuberosity, that lump of bone right in the center of the upper portion, proximal portion of the tibia. Of course, we're going to extend knee, extend leg, but we'll also use vastus lateralis to stabilize the knee, and as the others, innervated by the femoral nerve. Vastus medialis originates in the medial aspect of the femur. It will insert in the quadriceps tendon, extension of the knee as quads do, and innervated by the femoral nerve. It's a pretty easy group of 4, honestly. But let's check out 1 bonus muscle, and this is going to be called sartorius. And I remember this one from when I learned it, as the muscle that crosses over the quads helps us cross our legs. So it will originate anterior superior iliac spine, so further up on the ilium, and it will insert into the pes anserinus on the tibia, that collection of tendons we've talked about in the past couple of lectures. If you're having trouble thinking about what abduction, flexion, and lateral rotation of the thigh might look like, think about them all simultaneously occurring, and of course you're going to get that flipping of the leg over one leg, the action that we call crossing of the legs. The sartorius muscle will be innervated by the same as the quadriceps, the femoral nerve. Alright, hope you enjoyed that quick one on the quads. Thanks for watching it to the end if you did. Check out some more videos in my series if you want to learn more about A&P. Bye-bye.